ko lana yaduka yurmende ko lana mawka ka anda hore maka jogi doctorabe be immorbe e der lesde ko yata lesde capande nayi e der aduna fof so kono fewno do lana ka e hore ka arani ka dari e lesdi wete di Congo kono wodi mojobere yimbe immorbe e lana hay ngari Gambia be anda hore mabbe mbada do liggey molanado e der de balde garade e der gondene mum so ben doctorabe woni be dido be jidon be jodi do kamen woni be gananda hore ma kamen barata garta wadde on liggey e der lesdi Gambia ni no nani royto ni yeso e der programme suñu mbokk yi ñi nga xamantene yena nek olof yi wala ñuy dégg olof te yena nek di ñu sétan légui ni ci GRT ci ngon ci ñu ngi leen ay gërëm di leen santa ñu ngi ñëw fi tay ci ngon ci li nga xamantene mo nek Christian Talk waye tay ñu ngi leen indil ay gan yu mag ñi nga xamantene ñu ngi joggé ci Massisip ñu bari dégg nañ mbiram wala xam nañ mbiram ci bir Gambia fi nekkon nañ fi ci 2000 ak 2001 waye fu mu nekk ni gaal gi ci boppam nekku fii ci réew mi mu ngi Congo waye am na ñi nga xamantene ñoo jóge ci gaal gi ñëw ci Gambia fii ñëw def ci liggéey bi nga xamantene liggéey bu am doole la liggéey bu yéemaan la jóge ko ci ndimbal borom bi ñu ngi nekk fii ci ay semaines yu bari ñëw fii di def liggéey ci l'hôpital bi nga xamantene moo nekk l'hôpital bu mag bi bu nekk ci Banjul so danañ leen wax li nga xamantene loolu la gaay di ñëw di def ak bés yi ak kan moo war a ñëw ak kan moo war a am foofu garab tamit jërë ngeen jëf.
Thank you. Dr. Tony and wife, please tell us the work that the Massisip has done so far.
Well,
places visited and the types of work you've done.
Well, Mercy Ships first came to Africa in 1990, and the countries that the ship has visited have been Senegal, the Gambia, Guinea, Sierra Leone, Liberia, also Ghana, Togo and Benin, and in the East Africa, Madagascar during that time. I have visited and worked in all those countries except Senegal. But with Mercy teams, I have also been in Uganda and Kenya working, but Mercy Ships concentrates mainly on West Africa. I think we see this, that the home of the Africa Mercy, and certainly we feel our home is West Africa. And we have been volunteering for off-ship Mercy teams since 2007. And you may like to know that our first Mercy team was in the Gambia in 2007. We came in June 2007 to work at RVTH, and this is our 4th team visit here. And this time we are majoring on cleft lip and palate patients, patients who have been born with a defect in the lip or a defect in the roof of the mouth, and this makes it difficult for them to eat and speak. And also they can be considered by some to be demons, even people who maybe have not had an education otherwise, but they are normal babies who just have had a problem with the lip. All of us, before we are born, when we are developing in our mother's womb, we have 2 clefts in our lip, but normally those clefts will close to form the shape of lip that you and I have. But with these poor babies, for some reason, the cleft does not join, and so they have either a single cleft, a single line between their nose and mouth, or a double cleft. And sometimes in the roof of the mouth this does not join, and that gives a cleft palate. They can even have a cleft palate without a cleft of the lip, so the lip looks normal, but there is a hole in the roof of the mouth, which makes it difficult for them to eat or speak. They try to drink and the liquid comes out of their nose. Very difficult. But this is something that can be repaired, and our team will be working with the doctors and nurses at EFSTH to give training where training is needed, and to work alongside to care for these children. And what's more, we will give the treatment for free. There will be nothing to pay.
Thank you. Now, we have with us in our house our own person, Pastor Dr. Okafo, and he has been the anchorman for the Massisip. He has been working with them, and he is down here on the ground. He does work with us while the Massisip is not here. While the Massisip is not here, he does work. Doctor, may we hear from you?
Thank you very much. They came in November, and then together we screened the patients for this surgery. Some people came from the provinces, and then we presently have about 50 patients that could be operated presently. And their coming has been of great help because feeding programs were arranged because they were here. Prior to their coming, some of the patients we kept actually died because they could not be fed. But when they came and made provisions for this feeding, there has not been a record of deaths. You know, when you have cleft lips, the oral seal is not there, so patients cannot suck. The children cannot suck, and so if that continue, they could die of malnutrition because they could not eat properly. So on the ground, the patient has been fed, kept alive, and so we thank God for what they have done. So we've been taking care of these patients and making contacts with them. And so part of why we're here right now is to sensitize the nation for them to be coming to polyclinic, because we're going to be working together. It's the Minister of Health and Social Welfare and Edward Francis Mount Teaching Hospital authorities under their auspices that I'm here. So and everyone has been working very hard. The theater has been prepared on the ground, the wards, the recovery rooms, and everything being put together. So on 13th and 14th of this, that's Thursday and Friday, the week we're entering now, we're expecting everybody to bring the patients so that we can assess them again, we can screen them again, admit the ones that will be admitted, and prepare them for surgery that they have come for. They're going to be here for about 6 weeks, and between now and 15th of April, most of that period will be intensive surgery. They will be helping us, training us, making us effective to be able to continue when they are not here. So we thank God for what God is using them to do. Thank you very much.
Now, we want that to be interpreted for us by you two people, please.
Okay, thank you very much. Abarka Famban, Dr. Okafu.